Your new bundle of joy just arrived. Congratulations! As a new mom, you're likely aware of the importance of breast milk for your baby, and because of the many benefits, you may have plans to breastfeed your baby for as long as you can, maybe a year or more. So everything is going well for the first few days, but suddenly, you notice your baby is fussier than normal when they are at the breast. You wonder if your milk supply has dwindled and if your baby is receiving enough nutrition. If you have this concern, don't panic. Here are some tips on how to increase milk supply successfully. Number 1. Feed your baby frequently. Most women supply an adequate amount of breast milk for their baby, so it's relatively rare that you wouldn't be able to produce adequate breast milk for your baby's needs. Since your body is designed to produce enough milk to feed your growing baby, your body decides how much milk to make based on how much milk is taken out. Breastfeeding freely and frequently at least 8 to 12 times per day, ideally every 2 to 3 hours, will help increase your milk volume. Number 2. Increase the number of breastfeeds. Breastfeeding your baby more frequently may increase your milk supply. The principle of supply and demand also applies to breastfeeding. If your breasts remain full, milk is produced more slowly. The more often your breasts are emptied, the more milk is made. Offer your baby a breastfeed every 1.5 to 2 hours during the day and at least every 3 hours during the night. Allow your baby to nurse on each side until she unlatches. If your baby has been napping for more than 2 hours during the day, wake her up and offer her a breastfeed. Number 3. Use a breast pump. Breast pumps can also help increase your milk supply, whether you pump between feedings or while breastfeeding. The principle behind this method is the breast pump stimulates milk production by tricking your body into thinking your baby is feeding more frequently, therefore encouraging your body to produce more milk. You want to aim to pump several times a day for at least 10 minutes per session after your baby has already been fed. This will positively improve your milk supply. Don't be concerned that nothing is coming out when you pump. Provided you can feel the suction from the pump, it's stimulating your breast to produce more milk. Number 4. Hand expressing. Nursing mothers have been expressing breast milk by hand long before breast pumps were invented. Unfortunately, hand expressing is a skill that is rarely taught in busy maternity hospitals these days. When done correctly, hand expressing can be even more effective at extracting milk and stimulating milk production than an electric or hand pump. You can choose to either hand express or pump following breastfeeds to stimulate milk production. It is not necessary to do both. Number 5. Keep a breastfeeding log. As a breastfeeding mom, it can be tough to keep track of when you last fed your baby, or whether your baby is getting enough milk to grow healthy and strong. One way to monitor how well your baby is nursing is through a breastfeeding log. Inadequate nursing can decrease your breast milk production, so using a log can help you ensure that you're breastfeeding frequently enough. You can also record details to help you remember when to feed your baby next or identify trends, such as which breast your baby feeds best from. Number 6. Pay attention to your diet. Maintaining a healthy diet by eating adequate amounts of nutritious foods can help increase your breast milk supply. A balanced breastfeeding diet should include fresh fruits and vegetables, dairy products, whole grains, healthy fats, and lean meats and fish. As a new mother, you will be so busy it can sometimes be difficult to find the time to eat an adequately nutritious diet. However, you need to maintain a healthy diet including regular meals and snacks now that you're breastfeeding. Your milk supply will not be directly affected if your diet is inadequate, but your health may suffer as a result. Nursing alone requires about an extra 500 calories each day on top of what you would normally need to eat. You need foods high in calcium, iron and protein. Eat 3 healthy meals per day and regular healthy snacks throughout the day. Try to avoid junk food as much as possible. Number 7. Drink plenty of water. When you are lactating, you are constantly losing fluids. Staying hydrated is crucial for boosting lactation. Keep a water bottle by your side and keep sipping. The more that you stay on a hydration regimen, the more likely you are to maintain and produce a robust milk supply. Number 8. Ensure your baby is latching on correctly. If your milk supply is low, there is a good chance you can increase it by stimulating and emptying your breasts more effectively. The best way this can be achieved is to make sure your baby is latched on correctly. Once your baby is properly positioned, well latched and sucking effectively, the longer she nurses at your breast, the more milk will be produced. A baby who is well latched on gets milk more easily than one who's not. Number 9. Offer both breasts each time you feed. One-sided breastfeeding is often not enough while you are attempting to increase your breast milk supply. The more frequently you empty out both breasts, the better. While your baby is feeding, allow her to nurse for as long as she chooses on one side. When she has had enough, then offer your other breast. Babies sometimes fall asleep on the breast or pull away from the breast when the flow of milk is slow, and not necessarily because they have had enough to eat. Always offer both breasts to ensure your baby has had enough. Number 10. Get help from a professional. Breastfeeding has many benefits, but your journey may not always be stress-free. Ultimately, most moms do make enough breast milk to feed their babies, but sometimes determining how to increase milk supply requires professional assistance. Doctors and lactation specialists can assist you with milk supply issues, most of which can be easily treated and resolved. Breast milk is a gift that lasts a lifetime. One of the most common reasons nursing mothers give their baby bottle feeds is because they feel they are not producing enough milk for their baby. Fortunately, there are many ways to increase milk supply. There are many things you can do to improve your milk supply. Try one of these options and tell us how it went in the comments section below. And thanks for watching, Tiny Tribe parents. If you enjoyed this video, please click the like button, comment and subscribe to our channel for more incredible content that is on the way.